So what have we learned? Number one, images are representations of a subject and should not be confused with the subject itself. And if you go to radiology resident rounds, or if you hear a resident interpret an image, they'll say things a lot like you were saying, right? They have a measured approach to interpreting an image. They wouldn't say, here's a brain, right? They would start a little bit more systematically, like you were doing, a T1 weighted image, axial slice of the brain, right? And you might say a few more things. There might be an abnormally enhanced signal in a particular region that may be consistent with a hemorrhage, right? That's the kind of language which is an interpretation of a representation of the subject. Now, why am I putting it in these terms, right? A lot of what we're talking about here has to do with, information, right? These aren't, and the flow of information, the interpretation of information, and how we measure some information about a subject is actually really important. So these representations, of course, are spatially varying, right? They may be temporally varying, by the way. We didn't see any examples in that case, but some imaging systems could acquire in real time. But usually we're looking at spatially varying information. For example, the XYZ domain of the volume of the patient, and the different planes are represented there. The axial, usually called XY. And I'm puzzled why this one seems to be a left-handed coordinate system shown in this image. Am I right about that? I think so. I wonder why they chose a left-handed system. Well, anyway, that would put the coronal as the YZ, as shown there, and the sagittal as the XZ. By the way, those refer to nominally to the midlines of the patient, and so technically something that is not the midline might be called not necessarily a sagittal, but like a parasagittal or a paracoronal, if you will. And how about one that just kind of cuts at some angle through the volume? That's completely allowed. It might actually depict something more clearly. What might that be called? Oblique is the term, the tilted plane through the volume. But those aren't the only renderings. There's lots of ways to render image data. What else have we learned? These representations are quantitative, okay? These representations of the subject, right? We render those, we record those as numbers, right? And so that is the lesson of the day, is that images are numbers. And let me, if you need any convincing of that, let's look at this. Axial CT image in the region of a patient's chest. I zoom in a little bit on this region, and I zoom in even more, you really see that underneath it, it's a matrix. So the axial image is just one slice of a three-dimensional matrix of numbers. The numbers associated with each element of that matrix are shown here, right? And so in CT, those are measurements of what's called linear attenuation. The units of linear attenuation are usually converted to something called a Hounsfield unit. We'll talk more about that. But here's a histogram of pixel values within that image. And so it's just a histogram, so it plots the number of pixels as a function of the pixel value. And you see that in CT, right, different tissues with different linear attenuation are represented here. There's some background like air. The lung parenchyma are a little bit more dense, fat, muscles, and then what's up here in the tails of the highest end tails of the histogram? Bones, that's right. So images are numbers, and more specifically, they're measurements, right, of a particular quantity. Every modality measures something different, just like a stopwatch or a tape measure, okay? They're measuring some different quantity. I said in CT, it's measuring linear attenuation. Look, there was something else I wanted to say about that. Well, given that, oh yeah, so given that they're measurements, you know, you need to know that there are things like their measurements have error, right? And so understanding the error in measurement, there could be bias, there could be random error. That's an important aspect of evaluating the quality of an image or the performance of an imaging system. And what I was going to say is that not only is imaging, or is an image a measurement, it's not an overstatement to say that in medicine, imaging is in many ways the fundamental science of measurement, right? Underlying so much of medical image diagnosis and treatment evaluation, right? The images are really the fundamental measurement science underlying so much of imaging. Now, there are many other types of measurements as well, but imaging as a science is really a science of measurement. And it's really important to many things that we're trying to understand better in medicine. Okay, number 4. Well, they are measurements, but different imaging systems, called modalities, measure different quantities, right? Linear attenuation coefficient or other contrast mechanisms, right? What is it within the body that's making the measurement different at this point in space from this point in space? And here's a bunch of beautiful examples. These are different knees, but they're all different imaging modalities. And so I'll get you started. This is a lateral radiograph of a knee. So it's an X-ray radiograph. This one is a sagittal, any guesses? CT. So I see fat and muscle. I see a lot of bone detail in there if I were to zoom in, right? Certain ligaments. This one here, a sagittal MR of some particular modality or protocol of MR. This one here. Now it's a coronal, right? You can see it's a coronal image of the knee. And there's some form of nuclear medicine imaging here, like PET, and with some abnormal activity. This might be a tumor or infection or something like that within this area. The one on the right? Now, you really need to get oriented with this particular modality. We're seeing the top of the tibia, the bottom of the femur, and the ligaments associated with those two bones in the modality called ultrasound. Don't have to look at them as slices or projections. You can look at them as volumes, right? This is a volume rendering of a CT image of a knee. We said there are measurements not only in space, but in time. Here is a coronal view of the wrist as it moves in time in MR. Here is something similar in CT. Actually a 4-dimensional image of the wrist. Interesting, all 3 spatial dimensions at each point in time. All right, and number 5. No single modality is best at everything. Some modalities excel in spatial resolution. Some modalities excel in contrast resolution among soft tissues. Right? Some modalities excel in temporal resolution, right? So there's not one modality that is simply best at everything. So they all have some role to play within radiology.